Why the lockdown in the first place? I think most countries just copied China. I mean, the World Health Organization looked at the Chinese response in January 2020 and said, look, it worked. We committed ourselves to a policy that has had devastating consequences on the poor, the vulnerable, the working class. And we did it in good faith, but they were mistaken. Admitting that mistake, admitting that those mistakes led to those harms is a very difficult thing to do. If we keep this kind of policy in place, then I think that is the end of liberal democracy. The censorship and the repression and the civil liberties violations we face will become the norm. Thank you for that introduction. I want to spend my time going through a very brief history of what might have been in Australia had a more traditional pandemic plan been followed. The more, it's not going to surprise anybody in the room, the more traditional pandemic plan that ought to have been followed is the Great Barrington Declaration. The idea of the Great Barrington Declaration is actually as old as a century of pandemics, respiratory pandemic responses. The idea is you identify who's most vulnerable, who's at highest risk. You move resources, heaven and earth, to protect those people, but you do not disrupt society, the rest of society, because the disruption of normal social functioning will cause more harm to health and well-being than you will protect. That's the Great Barrington Declaration. That's the same idea. It's funny, I spent a career trying to write original pieces to publish in fancy journals, and I'm now most well known for an old idea that. How could it have played out in Australia? I have to say, looking at Australia, the Australian response, in particular the Victorian response from outside, it's actually in a sense a tragedy, because what happened is, the virus, I think, was seeded pretty widely by March of 2020 around the world. But it arrived in the southern hemisphere during your summer and our winter in the northern hemisphere. And so the COVID zero response in Australia actually worked in March of 2020. You rid the country of the virus. And that success led to the misery that has followed for the next 2 years, because once you have rid the island of the virus, and you as a political entity, you can claim credit for having accomplished this. It is very difficult then to say, okay, we should give this up. So whenever a case would happen, you'd have another lockdown after lockdown after lockdown after lockdown. And that sort of policy hysteresis, I think, is the reason why these traditional plans weren't followed. Why the lockdown in the first place? I think most countries just copied China. I mean, the World Health Organization looked at the Chinese response in January 2020 and said, look, it worked. That was the message coming from the World Health Organization. And most countries, they looked at Italy, they saw that there was this horrific death there, overwhelmed hospital systems, and adopted the Chinese response. So I think what was politically feasible, how would you have adopted the Great Barrington Declaration kind of ideas, the traditional plan? I think once you had that initial success with zero COVID, it was basically impossible to follow that plan until the vaccine. I think the plan still would have worked in Australia. It could have worked because the plan involves, before the vaccine, it involves thinking about how older people live in the community and protecting them. Right. So just to give you one concrete example of a failure outside of Australia that happened is in New York, for instance. The COVID-infected patients were sent into nursing homes, infecting a tremendous number of very vulnerable people who died at very high rates in New York, in Michigan, in Quebec, in Stockholm. Why did this happen? It's not because the people were evil. The health ministers were not. They're not dumb people, but they had the wrong idea about what the right goal was. The goal that they were following was protection of hospital systems, flatten the curve, not protection of vulnerable people. If the goal had been the protection of vulnerable people, that never would have happened. You never would have had COVID-infected patients sent to infect older, vulnerable people. So the mindset was just wrong. Instead, if the mindset had been protection of vulnerable people, you could have come up with creative ways to protect older people in the population. Organize drives to deliver food to older people when the disease is spreading rapidly. Work at nursing homes so that you reduce the amount of staff rotation in and out. Maybe even make nursing home work something where you live there for a week at a time to reduce the transmission between the community and the nursing homes. Testing resources deployed in places where really the vulnerable people live. Whole sorts of ideas I think could have worked to reduce the harm, even if you'd opened up early. I think that argument is hard to make in Australia. The success in 2020 of keeping the virus out makes it almost impossible to make that argument in Australia. It's an argument you can make outside of Australia, but not so much in Australia. But I think the argument you can make in Australia is the vaccines came available in December of 2020. December of 2020. The vaccine rollout in Australia did not truly get going until September or October of 2021. In much of the rest of the developed world, the vaccination campaign for the elderly had basically been in full steam in January and February of 2021. And by March of 2021, most elderly people in most developed countries had already been offered the vaccine. If Australia had followed that path, it had vaccinated older people. The vaccine is a fantastic tool to protect older people against severe disease and death. A terrible tool for stopping the virus and spreading, as we've all learned the last year and some. But if the Australian government had followed that path of using the vaccine for focused protection of the old, then you would have avoided a full year and more of lockdown. Why did the Australian government continue the lockdowns well into 2021? Why did they continue to follow zero COVID when you had a tool for focused protection at your disposal? Ironically, it's because of the success of the lockdowns. The impetus to vaccinate the population of Australia was delayed in part because there was no sense of urgency because zero COVID had worked. There was no COVID in Australia in 2021. What was in Australia in 2021 was tremendous collateral harms from the lockdowns themselves. You had in Australia, in Melbourne in particular, months and months where children weren't allowed to go to school. You weren't allowed to leave your house for more than an hour. Mass violations of civil liberties. The mental health consequences are I think you're just starting to experience the fallout from that. But even during, it must have been tremendously difficult to live in an environment where the public health people were telling you that your neighbor is a biohazard. The overwhelming of hospital systems, that actually happened even in 2021 before COVID started to spread. And after the vaccine rollout started to happen, and the idea was that everyone needed to get vaccinated in order to stop the disease from spreading, that led to the vaccine mandates that then led to many nurses quitting their jobs because they didn't want the vaccine. And that overwhelmed hospital systems. Delayed cancer treatment. Women and men are going to show up with cancer in late stages that should have been caught over the last 2 years, but are going to die from their illness that should not have died. There's a long tail to this, and the harm, especially to kids, is tremendous. When you have kids miss school for even short periods of time, a month, 2 months, 3 months, it turns out that has lifelong negative consequences. There's a social science literature that goes back decades that have looked at this. Interruption of kids' schooling leads to children that lead poorer lives, certainly, more likely to be unemployed, but also less healthy lives, more likely to be chronically ill, and shorter lives. One estimate in 2020, published in the JAMA, Journal of American Pediatrics Association, Journal of American Medical Association in Pediatrics, found that the spring lockdown in 2020 in the United States had cost American school children 5.5 million life years in expectation that they'll be paying for the rest of their lives. Our kids in the United States are going to live shorter lives, less healthy lives, because of our fear of COVID and our desire to protect older people by sacrificing our children. Ironically, it didn't actually protect anybody. Schools were not the driver of transmission anywhere. Sweden kept its primary schools open through the whole pandemic with no restrictions. And in fact, they have zero or negative excess mortality through the whole pandemic. Teachers at those schools, because kids are not super spreaders, in fact, they protect people who are around them. Because if you ever had little kids, you remember being sick all the time when they were little. That probably protected you from the disease, because this is a coronavirus. There's some cross protection. The teachers themselves in Swedish schools had COVID at rates lower than the rest of the other workers in the population and died from COVID at lower rates. The kids protected the teachers because they were open. So these collateral harms are, I saw the report that you all did. I think it's absolutely vital that people start to understand how great these harms are. I think the report is great, but you're just beginning to pay these harms. The economic harms, which you were not allowed to mention, themselves will have negative health consequences. When you do economic damage on the scale that's been done, small businesses devastated, the inflation that the United States and Australia and the rest of the world are facing, that's a lockdown harm. What do you think? What do you think will happen when you spend, in the case of the United States, trillions of dollars that we don't actually have, borrowed and printed? What consequence will that have other than inflation? And that inflation harms the lives of the poor, who are hit hardest by rising bills so they can't feed their families well. The only way forward then is to be honest with ourselves about what we've done and about the failures that have happened. The idea of a royal commission is a fantastic idea, but I think it's going to be very difficult while the people that made these decisions are still in power. It's in my mind, it's like the Iraq War. It took years to come to terms with what the Iraq War had happened, and public opinion changed slowly because many people had committed themselves to the idea that the war was a good idea. And it's very difficult for public opinion to change once you've committed to that. That's what happened to much of the world, certainly in Australia. We committed ourselves in the United States, Australia, much of the rest of the world to a policy that has had devastating consequences on the poor, the vulnerable, the working class. And we did it, I think many of the people did it in good faith, but they were mistaken. And admitting that mistake, admitting that those mistakes led to those harms is a very difficult thing to do. So the question to my mind is, how do we get people who committed these mistakes to come to the table and say that these actually were mistakes so we never do this again, that lockdown becomes a dirty word? I think part of the answer to that is we can't, in medicine, if you have a patient that dies, you'll hold a conference. It's called a morbidity and mortality conference, where all the doctors that were involved will come together and, without trying to point fingers, say, what mistakes caused this patient to die? We have to have a worldwide morbidity and mortality conference, not to find villains, but to adopt policies so that this kind of policy never happens again. We are going to have pandemics in the future. And if we keep this kind of policy in place as a tool in our toolkit, then I think that is the end of liberal democracy. The censorship and the repression and the civil liberties violations we face will become the norm. And people will no longer be able to count on those kinds of basic guarantees of civil liberties so they can plan their lives in productive ways, make investments in productive ways. It will have long-term consequences, I think, that will, and I don't want to be too alarmist, but I feel this is true, is that Western civilization that we know is at stake in this. It is absolutely vital that people understand that this was an enormous error, the worst peacetime public health error in human history. And that we respond to that with the kind of seriousness that it deserves, so that we count the costs, convince people that it wasn't necessary, and then commit to never do it again. Thank you for your time.
Sorry, Jay, just before you sit down, thank you so much for that powerful presentation. I have three questions, which I don't want to let you go. The first is just to clarify for those of us who aren't experts in medicine. Of course, when you say protect vulnerable populations, age was the great proxy. If you could just run us briefly through the numbers and the morbidity.
Absolutely. So early in the pandemic, I did a study of antibodies in the population in Santa Clara County, where I live in California, and in Los Angeles County. In April of 2020, about 3 or 4% of that population had already had antibodies in their bloodstream, meaning they'd been infected at a time where people thought only a few people had been infected. That turns out there were 40 or to 50 times more people that had been infected in California than was known to public health at large. That meant that the mortality rate from COVID in the population at large was 0.2%, 99.8% survival. But the single biggest risk factor was age. So that if you're 50 years old, 99.8% survival. For every 7 years of age, this is from the original Wuhan variant, Omicron's less deadly. In the original Wuhan variant, every 7 years of age, it doubles the risk of dying. So if you're 50, the risk of dying was 0.2%. If you're 57, it's 0.4%. If you're 64, it's 0.8%. And you can just double. If you go down, you get to vanishingly small numbers. So for children, the risk of surviving is 99.999. No, I'm going to run on nines. It's very low. I mean, the risk of on the other hand, the risk of the lockdowns harming children was very high. We unethically harmed our children in order to protect older people that could have been protected using other means.
Thank you, Jay. The other thought that I have is you described that period of panic essentially, and pandemic response became slid very quickly into state of emergency. And I think in Australia, they're almost interchangeable terms, and we're still in a state of emergency. Many jurisdictions around the world are in a state of emergency. But this idea of a pandemic, I mean, even Joe Biden now says
it's over.
It's over. So when is the pandemic over?
It's certainly over now. I think the question is, I mean, Australia, it's definitely over. You walk around, I don't see any. All the pictures I saw of repression are gone. Melbourne feels like it's a open city. There's masks, yes. But those are people that are still people recover from fear slowly, one by one. The pandemic's over. The end of a pandemic and even the beginning of a pandemic are never simply medical or epidemiological decisions. Those are social decisions. Those are political decisions. The question is, what risks can we put up with? What measures can we put up with? And the pandemic ends when the measures are so severe that it's clear that they're not that we're more willing to put up with the risk of the disease itself than the measures. So in that sense, Melbourne was in a deep pandemic for a very long time, until maybe January of this 2022. Melbourne was a pandemic, and the pandemic ended when those measures ended. Yeah. I think the pandemic in much of the United States, red states, Florida, for instance, it's been over basically since May of 2020. But in blue states, like where I live in California, the pandemic still goes on. But it's a political decision and it's a social decision. It was a huge error to try to allow people like me to be put in charge of society. I don't have the wisdom to do that. I'm not accountable to the people. And if I make a mistake, you guys pay and I don't. Right? I get awards like Tony Fauci.
Yeah. One last question. Also, as we have behind you, Collateral Global. So your efforts to educate decision makers, educate the public continues. If you could just tell us briefly about Collateral Global.
Sure. Oh, sorry, I didn't notice that. So Collateral Global is a new charity in the UK that I helped found. Actually, the charter of it is very similar to the Royal Commission charter that you said. What we want to do is we want to document the harms that have happened to people in developed and developing countries from the lockdowns. Collect the best evidence for both published and in the gray literature, so that anyone that asks you, well, prove to me that lockdowns have harmed people, you can just point them to Collateral Global, and the best research is collected there. We're going to start inviting fellows for Collateral Global who will do research on the harms of the lockdown. It's an entirely apolitical organization, it's a charity. The goal is to document the lockdown harms around the world, and I've talked about the lockdown harms in developed countries. In the developing countries, the harm is catastrophically worse. Tens of millions of people thrown into poverty, millions of people starving, including children at very, very high rates as a consequence of the economic dislocation caused by the lockdowns. You said the economics is about lives. Nowhere is that more true in poor countries, where people live at basically hand to mouth. Over the last 40 years, we globalized the economy, lifted 1 billion people out of poverty. The way that happened is that the poor countries reorganized their economies to fit into the developed world. Overnight, we broke that promise. Millions of people died as a consequence of that, and will die over the course of years as a consequence of that decision. I think so. That's the goal of Collateral Goal, is to document that, so that when these commissions happen, you have a database, a reliable one, created by people with who are qualified to make these assessments, to point to.
A commendable aim. Ladies and gentlemen, please thank Professor Jay Bhattacharya.